In this video, I'm going to show you how you can use massage guns like this to alleviate knee pain. What's up guys, it's Dr. Mike, physical therapist. Now if you're dealing with knee pain, that you probably have seen devices like this out on the market, and you're probably wondering if these are effective, can they benefit you in any way, and just how to properly use these tools when we're dealing with knee pain. Now these tools here are actually called percussion or massage guns. They typically can be used by people who are dealing with muscle soreness, stiffness in a specific area, and can help promote blood flow and relaxation in that area. So today I wanted to show you how to properly use devices like this to alleviate any knee pain or discomfort you might be having. And make sure to stick around to the end of this video because I wanted to show you two things that you should not do while using these tools. Now, before we dive into just how to use these devices correctly, I think it's important for us to discuss kind of the attachments and what these devices usually come with. Now, usually you'll have devices that'll come with attachments that have a smaller surface area, even plastic, and also keep in mind that you'll receive attachments that will have a larger surface area with more of a softer endpoint or attachment at the end there. Now, the larger attachment that you use on the gun, the more generalized you're going to get when you're massaging the gun versus if you're using something as small as a dime or a quarter with a plastic end, it's gonna allow you to actually penetrate the skin a little more, as well as it's probably going to be a lot more localized in that specific area. So maybe some of you might have a specific pinpoint where you can find maybe trigger points or some areas on the tissue that is tight, and you can really localize that area. But if you're someone that has maybe more pain, very sensitive at the moment because that knee is maybe flared up, you definitely want to go with a larger attachment with a softer attachment to be a lot more generalized when you're going over the skin there. Now for the purpose of this video, I'm just going to use a medium-sized round foam attachment here. Now when we're discussing knee pain, some of the common areas that we see as physical therapists that contribute to knee pain are typically all the muscles surrounding the knee. So we're talking the quadricep area, especially that lateral aspect of the quadricep, even the calf area, as well as the lateral hip. We have a muscle called the tensor fasciae lata. It's connected to the IT band, which can commonly cause a lot of issues in the knee there. So when we're focusing on using tools like this, we want to focus on working a few minutes, I would say 1 to 2 minutes in each of those positions to try to alleviate some of that knee pain. So if we turn it on the very lowest setting, one key to work on is to first you can go at the same orientation as the fibers. So if the muscle fibers of the quadricep run kind of up and down, you can slowly take the gun or the percussion massager and kind of work your way up and down the quadricep. Now you might find some locations that are a lot more sensitive and you want to spend a little bit more time maybe in that area because usually that means you have some stiffness there that needs to be released, okay? You can even start to focus on the lateral side of the hip. Notice I am sitting while I'm doing this. You can also perform this standing, okay? And then if you wanted to address the calf muscle, you can bring your leg up and address kind of like the inner calf area there, which can be very sensitive for people. But also you can kind of get behind the calf if you're sitting down on a chair right there, okay? Now, one technique that I often believe gets underutilized is by using these massage guns and really working on active range of motion as you're moving your leg versus just kind of working on an area with your leg in a static position. The more that you can move through some of that tissue and try to loosen up that tightness and get more blood flow in that knee area, the more relief you're gonna have and the less stiffness that you're gonna experience. So really focus on trying to extend your leg out and really try to get that muscle in a stretched position. And when you're working here, you don't need to spend 10, 15 minutes on this tool. You can really focus on 1 to 2 minutes per muscle group and really find great relief with that. Now, as I mentioned earlier in the video, the two things that we should definitely stay away from while using these devices is number one, going over bony prominences. So we're specifically talking over the kneecap or over the patella. We definitely don't want to use any compression or vibration over the top of the knee, especially if you're experiencing pain, because it's definitely not going to feel good, as well as being very careful with the structures on the lateral aspect of the knee, specifically the fibular head, which also has some smaller peripheral nerves that are very superficial. With a little bit of pressure, you can actually cause some of that area to go numb or even tingling. So you want to stay away from that. You should definitely stick to focusing on anywhere where you feel soft muscle. So that's the inside of the calf, the lateral aspect of the calf, even behind here, as well as working on the quadricep area over the top, lateral aspect of the quad, and even on the inside where your hip adductors are. And the second thing you shouldn't do is keep the massage gun in one specific area and turning it up to the highest setting, because what that's gonna do is gonna create a lot of trauma to the skin, a lot of impact to the skin. And if you're someone that hasn't had any massage done before, any body work done, you could definitely experience some bruising or even some muscle soreness that is just not gonna feel comfortable for that leg. So overall, I believe these devices definitely have their place and could be a great adjunction in your toolbox, especially if you're someone who is proactive about your health and your recovery, and for some people that are just dealing with stiffness or tightness on a regular basis in their knee and just want to solve it themselves there. Now, if you want to learn more on how to get rid of knee pain for good, check out these 2 videos I made here. In the meantime, if you found value in this video, please like and subscribe to the channel, and I'll see you in the next one.